Hi, this is Dr. Fab Mancini, and I'm so excited that you've decided to watch this video, primarily because I'm going to be interviewing one of what I call chiropractic greats. Not only a dear friend, but what I find is somebody that is a true leader, somebody that has been successful in serving patients as a chiropractor, but also somebody that has been very successful at helping other people be successful, creating models, advancing technology, and he's also one of the most forward thinkers that we have in chiropractic, and as a dear friend, and that is Dr. Jay Greenstein. Hey, Jay, how are you today?
Thank you, man. I really appreciate that very kind introduction. I'm humbled by it, especially coming from you. So thank you, sir.
Well, I'm excited because I know you got a birthday coming up and celebrating it chiropractic on the chiropractic. It's like every time that your birthday comes, everybody in chiropractic is celebrating your birthday in chiropractic. So
it's not a bad thing. It's not a bad gig.
Well, I want to ask you about multiradiance primarily and the utilization of laser technology, especially the superpulse laser therapy that multiradiance have brought into the forefront. You have 4 very successful clinics. Kaiso Health has been one of the leading entities in chiropractic that has really shown a model that works, especially in today's time. But what was it in your initial introduction of laser therapy that you saw the benefit of how it correlates your clinical care with chiropractic?
Yeah, so Fab, I think for me, one of the most interesting things is when I was introduced to multi-radiance and to laser treatment in general, there was good evidence around the use of lasers. And that's really important for us as a evidence-based practice. We need to know that what we're doing has some level of science behind it. And so, we equipped our offices with lasers, and very close to when we just brought the lasers in, I tore my Achilles. And it wasn't pretty. And I had one of the home units that I brought home with me, and I started using the laser literally from day one. Now, I did have surgery, but I called Max and John, who are the 2 of the leaders. Max is the owner of Multi-Radiance, and John is one of their leaders, and just asked them about what are the appropriate settings? What should I use for this particular injury? And I started using the laser, and I had done other things as well. I had done some other soft tissue techniques, et cetera, but the laser was a big part of what I did. And I had my surgery. I used the laser in my recovery. And when I went to see the orthopedic surgeon to have my first checkup to get my boot off, not right after post-surgery, but to get my boot off, he was amazed. He's like, "What are you doing?" And I was like, "Well, I'm doing the normal stuff, like the home exercises, and I'm doing, some eccentric training. I'm doing all these things, but I got to tell you, what has actually made me feel better and reduce the pain and inflammation was the laser." And he was like, "Keep using it." So that was his words of advice. So I was very fortunate to have an amazing clinical experience for my own injury and recovery. And I think it's been really helpful in our practices to be able to use the laser, especially on challenging cases. When someone comes in and they've been through what I would call a standard course of care that's not responding, adding laser has had a significant advantage for the outcome that our patients are achieving, because it's just helping them get better results. So it's been great.
It's interesting that you started by mentioning the evidence base, and that's one of the things that actually how I got introduced to it. I have my son that was going through some challenges, and I was looking for what was out there, and I couldn't believe how many peer review studies they have, how much science they truly have. But you also mentioned about the leadership of the company, from the owner of the company to many of the individual clinicians that are just waiting for anyone to ask questions about protocols, and their experience is so vast. But let's talk a little bit about the word that you use, and that is the importance of being evidence-based today in chiropractic. Primarily, if you're going to use a laser, you definitely want to use, a laser like multiradiance because it's evidence-based. But help me explain a little bit about what that means to you. You're in the trenches every day. You also in many leadership subgroups that are really trying to move the profession forward. But why is it that chiropractors today should really leverage the evidence that we have behind chiropractic or any other service that we do, especially when it comes to the credibility of our profession?
That's a great question, Fab. And evidence, first and foremost, when it comes to your practice, is critically important in building trust with your patients. Like your patients don't know if you're making a recommendation because of your own clinical experience, the scientific literature, their own values, which actually the three of those things is evidence-based practice, or you're just making it up out of the blue. So I think, for us, when we talk about how we're going to address and treat a certain condition, we always bring in the evidence. The evidence has shown X, Y, or Z. Laser can improve cellular function. It can decrease pain. It can decrease inflammation. This is what we know about the evidence, and we think it's appropriate for your particular clinical condition. But evidence also moves the needle as it relates to educating other healthcare providers about the treatments that we provide. Medical doctors, for the most part, don't really understand chiropractic. They just don't. And using the evidence as a tool to help them understand why to refer patients to us is very important. Also, evidence changes policy. I mean, you and I have been in the trenches as it relates to policy and moving the needle for legislation and other important issues in chiropractic. And when we are able to say, hey, folks, this is the evidence that supports the clinical decisions that we're making. This provides access to services for patients that need this type of care. Who can argue with that? I mean, you can't say no, because you'd be saying that science isn't real. So evidence is critically important for chiropractic. It's grown tremendously in the last 27 years that I've been a chiropractor, and it will continue to grow exponentially as we have more and more studies that are performed on not just chiropractic adjustments, but also the other tools that we use in practice.
Let's talk a little bit about maybe one case. I'm going to put you on the spot, but maybe one case that maybe the combination of chiropractic care and using, the multi-radiance unit really surprised you, maybe, or surprised one of your patients. I know you share the one about you, but maybe one case that maybe stands out in your mind where you were like, man, I'm so glad that I have this technology in my practice.
So this is going to be a little odd, but I'm going to share it with you anyway, because it's the one that stands out. I mean, if you want to talk about true surprises, it has to do with my dog, Deputy. So I have a dog, he's 12 years old, and about 2 years ago, he was dealing with a hip issue. And he was limping and we couldn't figure it out. And I was actually doing some manual therapy on him, and I was doing some massage, and I was trying to mobilize his hip, but he didn't want any of that because it didn't feel comfortable for him. And then I started using the laser on him. And I'm telling you, Fab, within three treatments, he was walking better, he was moving better, he was allowing me to mobilize his hip. And so, and intermittently, we still use it on him on a regular basis. So that's probably the most surprising, because, a dog, there probably is no placebo. Maybe there is, but either it's going to work for the dog or it's not. We both are very good friends with Mitch Malley and PJ, and they've got horses and other animals they use the laser on all the time. So that was like my inspiration to use the laser on Deputy. But that was a great learning experience for me, because I'm like, if it can work on a dog who's not telling me, one way or another, I'm just seeing the results. That's remarkable. But when it comes to certain conditions, I think peripheral neuropathy is really one of those conditions that really responds well and has responded historically well with some of the providers and patients in our practices. That's a tough condition to treat, but many times they've responded well. And that's one thing that sticks out in my mind for sure.
So now we're going through this COVID era in chiropractic, which I've been putting out a message out there that this is our time to become the most essential healthcare provider in the healthcare system. I believe that God has given us an opportunity to reintroduce ourselves as an essential healthcare provider. We have tools, we have knowledge, we have experience that it puts us in a very good position. Now, what would you say to a chiropractor out there that is going through this difficult time? Maybe they're being more challenged than they anticipated. They're having a hard time. And what would you say for them to be successful? Your clinics are blowing up. I mean, you continue to grow. I know you add the laser therapy within those standards, but what would you tell somebody out there that maybe is looking for some hope, some guidance?
Sure, that's a great question, and you and I could probably share stories and ideas on this for hours, but I'll try and keep it as brief as I can. I think the first and most important thing is, you've got to have the right mindset. you've got to really be focused on the opportunities and not focused purely just on the problem or the situation that you're in, because your mindset will dictate, your thoughts, beliefs, and behaviors, and therefore your results. I think the second thing is you've got to really understand what the community wants right now. And I've done some, in the spirit of research and science, I've done some work just kind of investigating what consumers are looking for right now. And they're looking for experiences over things. They're looking for a digital connection to practices. They're looking for safety, and they're looking for trust and responsibility. Those are things that consumers and patients are looking for right now. So how do you, one, provide that? And then how do you communicate that effectively through all of the channels that are available to you, both in person and digitally? And so having a strategy around that, like making sure that you've got safety protocols. And here's where I would say protocols is appropriate, but they're also standards. Safety protocols and standards for your patients. You're wearing masks, you're cleaning, all of your equipment up, you're following all the OSHA guidelines, et cetera. And then communicating that to your patient base and your community at large. What are the services that you still can provide safely for patients that require it? Let's face it, Fab, you and I both know low back pain and neck pain are not going away because of this pandemic. It's probably getting worse. People are sitting at their computers all day long doing this. And so can patients come to us safely? Yes, they can. Show them that. Show them patients wearing masks, getting treated, getting adjusted, getting laser. Show the population this is happening in your practice. And then also making sure that you're communicating, how this is helping patients at large. Testimonials are always a great way to go to communicate the effectiveness of your care plans. Offering up webinars where you can actually communicate with patients digitally to find out what they're looking for in terms of healthcare services and the things that you can do as a chiropractor. I mean, the opportunities to communicate with the community and your patients at large are endless, but you've got to have a strategy. So again, understand what patients and the consumers want. Have the right mindset, then understand what patients and consumers want, and then have a strategy and execute that strategy both in the office and to your community and your patient base in communication, and you'll do great.
There's no surprise why you guys have been so successful, because you do have a pulse. You do have a pulse about what the community needs, and that's always going to drive the service. I know a lot of times, we all get so excited that we want to just shout chiropractic out of the rooftop. But in reality, most people we know are not looking for a chiropractor, have never been adjusted in the first place, have no idea really the value of chiropractic. So I'm going to ask you one more question.
Sure.
If there's somebody out there that maybe have heard of SuperPulse laser therapy, if somebody out there that have heard of integrating this into an office, somebody out there that maybe even has a laser, they may be sitting right now with a laser there that they're not utilizing to the degree that they could to serve their patients, what would you say to them?
I would say to them, well, there's two different people that we've just talked about. The first one is the person who has the laser who's not using it. I mean, the very direct advice that I would give is use the laser. Try it on your patients. Watch the responses that happen in terms of their outcomes and experiences, because I think the more that you will use it, the more you will use it, because you'll just see the results that you're getting. The second person that you described is the person who's never had a laser in their office. And I would say, first, I'm glad that you're here watching this interview. That's great. Fab is amazing and he's inspirational, and hopefully I've been able to provide some value today. But if you don't believe us, just look at the scientific literature. And once you understand the science behind the use of laser, it's almost a no-brainer to have it in your practice. And just like the first type of person who has it is not using it, once you have it in the practice, use it on a wide variety of patients, and you'll see the results that you'll get based on the conditions that are coming into your door and how you can help serve your patients even better. So that's my advice.
Well, that's amazing. And I just want to say thank you. Thank you for being such a great leader, a great friend, a great chiropractor, a mentor to all of us, because I know you work hard. You've been relentless since I met you, and you continue to raise that bar for yourself and for the profession. And I think that that's always a great sign of a great leader. And for those of you that are listening, I hope that you listen to Dr. Greenstein. I hope that you took notes. I hope that you put into action what he's suggesting. And feel free to click the link here so you can get more information about the multiradiant SuperPulse laser therapy, because I want you to know, I know that you will thank us for that. I know that it's information and awareness that would allow you not only to be able to be a better clinician, but to actually really grow your practices to dimensions that you probably have not experienced yet. So thank you, Jay. It's always a pleasure.
Thank you.
I love you. I appreciate you. And I
love you, brother. Appreciate you.